Did you know that skimping out on your dental hygiene could lead to heart failure and even death? While this might not be the case for everyone, many people don't realize how your dental hygiene can affect your overall health and well-being. Well, I'm here to tell you. My name is Haley Parks, and today I will be giving a speech on the importance of dental hygiene and at-home care. We will be discussing the different consequences that arise from poor oral hygiene. We will also talk about how to improve on oral hygiene and at-home care. In the past few years, I have worked in multiple offices as a dental assistant. As a dental assistant, it is my job to assist the doctor with any kind of procedure such as crowns, extractions, root canals, etc. As someone who has been in the dental profession for years now, I have seen the worst of the worst. In saying this, I've also seen how inaccessible dental procedures can be. In this speech, I will inform you of different techniques that are used by professionals in order to use at home to maintain the best oral health possible. The first thing that we will be discussing is the different consequences from not brushing and flossing properly. Like I previously stated, poor oral hygiene can lead to infection and bacteria getting into the bloodstream. This then leaves the individual at risk for heart failure. Another effect of poor oral health is dementia. According to Geisinger.org, those who did not take good care of their teeth were 65% more likely to have dementia than those who did. In addition to bringing about new health issues, poor oral hygiene can also worsen pre-existing ones. One example of this is diabetes. Diabetics with poor oral hygiene can then start building a resistance to insulin. If you know anything about diabetics and insulin, then you know that this could be detrimental in the life of a diabetic. Another health condition that is prominent in those with poor oral hygiene is pneumonia. With pneumonia, whenever you have an infection in the mouth, these microbes can then be inhaled into the lung and cause a persistent case of pneumonia. According to Geisinger.org, Dr. Stinton actually did a study on this, and he stated that those who improved on their oral hygiene had improved their pneumonia by 40%. These are just a very few of the drastic health conditions that can be caused by poor oral health. And if I were to tell you every single one, we would be sitting here all day. Now, I know what you might be thinking. Maybe I can't afford adequate dental care, or I just don't have all the time for the procedures that I need. Because of this, I will tell you some ways that you can improve on it yourself at home. One of the most important things, as many of you have been told from a very young age, is that you have to brush twice a day, every morning and every night. When you let bacteria sit in your mouth overnight, it can then harden and become calculus. This calculus is extremely difficult to get off, and you will have to go see a hygienist in order to get this hardened plaque off. It would honestly be much cheaper if you just maintained good oral health at home and didn't have to reach this point. Another way that you can improve your oral health at home is by purchasing a water flosser. A water flosser is much easier than string floss and also much more effective. Here I have pictured a water flosser. There are many different types of water flossers, both affordable and a little bit more expensive, but overall, using a water flosser will greatly improve your oral health. This will also reduce the risk of getting gum disease, also known as periodontal disease. The last tip that I have for you is to improve your oral health is to regularly go to your cleanings and checkups. For most people, you only need to attend cleanings twice a year. Whenever you attend these cleanings, they will do your routine exam, and you are able to catch things much sooner than you might have if you only attended when things started hurting. For example, it's much cheaper to have a filling done than it is to have a root canal done on a tooth. Overall, I hope that you have expanded your knowledge in dental hygiene today, and you've also learned some different ways to do at-home care. Today, I've discussed the different health conditions that can result from poor oral hygiene, and I've also given you some ways to improve your home care. These ways include brushing twice a day, using a water flosser, and attend your cleanings regularly. Thank you for your time.